Hi, this is Take Charge Your Health with Corinne Fernari, clinical nutritionist, physician assistant, and Carol Peterson, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corinne Fernari, clinical nutritionist and physician assistant, and my co-host, Carol Peterson, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health.
Welcome back. Welcome back. We have a special show today. We have Dr. Iman Bar, and what we are going to be speaking about is something we don't often get to. And what we regularly speak about hormones, both myself and Carol. But today we're going to shift the picture. We're going to speak about peptides. We're going to go into a deep dive on peptides. But guess what we're going to look at? Peptides are very unique and very specific. And we're going to be looking at male sexuality. And this is a topic that doesn't get discussed very often. And today we're diving in. So welcome to the show, Dr. Bar. And what we're going to be discussing, like I said, we're going to be discussing peptides. But what is happening with peptides is a revolution. It's a totally new frontier in medicine. It makes me feel like how we've been working up to now is like we've been using a sledgehammer. Now peptides are like using a fine tool to dissect and to direct. And what do you think about that, Dr. Bar? What I was talking about is the fact that up to now we've used hormones to create balances, and that has been very powerful. But there is an overwhelming downside to specifically giving testosterone to males. And it creates a suppression in their own hormonal loop. Can you explain that to us? Or you can start where you want, and I'll catch up with you.
No, unfortunately, it's a very common thing because everybody's opening a testosterone or TRT clinic somewhere.
Exactly.
Yes, without the proper clinical guidance. And everybody's asking for testosterone. Unfortunately, I would never give testosterone to young men. It is an epidemic. We know young men are having lower and lower testosterone. We can talk about that, why this is happening. But once they're tested once and not in an optimal condition, for example, if they were a little bit sick or one played a football game or something, and they go to one of those like mom and pops things that are popping online everywhere, not even properly guided clinically, and the testosterone is low without figuring out why is it low. Were they like not feeling well? Were they stressed for some reason or played some sports? They would just put them on testosterone, TRT. And unfortunately, anybody...
men.
Yes. So nobody should be on TRT. I would say, like, I have a threshold. I say 45 usually is, the age that I go by. Depends on their whole situation. That they have babies and they don't want to have anymore, because that's going to create a major suppression of their sperm count. So if somebody's established, has their babies, and they're 45, yeah, maybe I can give them testosterone. But before that, I don't attempt to do it unless somebody had like a major testicular surgery or injury, right? So these clinics that are giving TRT with high doses,
I know.
I'll be very happy to tell you, like, if you can guess what is the daily dose that a person creates each day in their body at their peak prime time. How much do you think their body makes? Guess. number. So these clinics give them like 200 a week. Do you think that's a fair number?
I think that it creates a tremendous, it's like living on a roller coaster.
Yes.
And so they're high from the testosterone and then they crash and then they come in and they're high again, which is what I see are problems with the way that it's administered.
Yes, that's true. So a daily production of a male testosterone in his peak would be 6 milligrams a day. Multiply that by 7 if they want to give him a weekly shot. That's like 40, right? 40 something. If you want to add up a little bit and round it, maybe 50, but most clinics give 100, 200. It's bad. Besides, you pointed a very important thing, the roller coaster. So they give them an injection in their muscle. It just goes into the blood fast, peak, and they get so hyped up and just like angry and or like hyper, right? Because it's just an upper hormone. And then they crash. So because the duration is not like a week, it doesn't last in their body for a week, maybe 2-3 days, their peak, and then they drop. So that is the problem with the current status of giving people TRT in all these clinics. And I think there should be, intervention. The government or the FDA or somebody has to do something with this use of, I want to say, illegal testosterone, even though it's a controlled substance. But you can't give it to people who do not know how to use it, unfortunately.
But that seems to be nationally. They're setting up these clinics all over the country. It's not like it's just one or two. They're all over the country.
Yes.
And men are flocking to them. And there is a reason. There's a reason because what we're seeing is men aren't feeling their best. They're looking for something that will help them feel better, feel stronger, more vital, more vibrant in themselves, in their maleness, in their sexuality. So there are these signalers. I'm going to switch to the signals. There are these signalers that don't suppress our own body, that don't suppress our own hormones. And can you explain that to us? Peptides. We are hearing peptides. Everybody's hearing peptides, but they don't understand them yet. And I really think this is an important talk today.
It is. So I'd like to start by the male sexual journey. How things happen in a male hormone journey. First, they get stimulated, right? So we need hormones or peptides, if you want to call them, to get that libido or stimulation or the desire up. Then,
so peptides are natural.
Yes, they are natural by your body.
Okay.
I'll get to that. So once they get stimulated, they get an erection, which another thing that is turned on by certain hormones or peptides. Peptides are little teeny molecules that we know that actually do the function of, a hormone if it signals the receptor. Then the third part of the male sexual kind of journey would be reproduction or production of sperms, so that would take them into the state where they their vitality creating sperms and repopulating the universe, right? So these three parts in the male sexual hormone, let's say, journey, all of these are controlled by hormones or neurotransmitters, if you want to call them, or signaling proteins. These are the teeny amino acids or steroid molecules that are actually created in your body. They go to the receptor and turn it on or turn it off. So these are really the peptides. They're a few amino acids stuck together. People take amino acids now to build muscles and all that kind of stuff. So everybody knows what an amino acid is. It's the building blocks, the Lego for protein. So these amino acids have a function. They're signaling function. So they would turn on the receptor in the body to do a job. And then once the job is done, it turns it off. So that's where peptides are. And it's not something new. It's been available in our bodies. Everybody can use it. And there are major, as I said, like sections in our system of sexual health for males that we can use different peptides to address. So there are peptides for libido, peptides for erection, and peptides for changing your hormones so that you can produce sperm and reproduce. So that's how we want to divide it, because peptides can fix anything in your body. There are peptides for skin, peptides for hair. These have been known for quite a bit in the United States. Everybody's used peptides for skin and hair, and they're quite available even in any store or pharmacy. But people started talking about peptides just recently, maybe 10, 20 years ago. People started learning more and more on the use of peptides. And until now, they're not a drug. They're not under an FDA kind of clinical study. So they were called research molecules or research substances because they are not taken by pharmaceutical companies. So they're not categorized as a drug. However, if one peptide stimulates your growth hormone or your testosterone, don't you think that should be regulated and should be a drug?
Well, it's definitely caught us and taken our imagination and our ability to heal to a different level. But we started out with a little bit of hesitation because you couldn't speak. So I want to go backwards and introduce you. So could you tell us how you became interested in this field?
So, long time ago, I graduated from medical school. I was a hematology oncologist. After finishing my residency, I decided I want to be involved in gene therapy and stem cells. That's like in the early 90s, a long time ago.
Mm-hmm.
And that was my vision. Like, I think stem cells is going to be the future. We're going to treat everything with stem cells, and modifying the genes that are in these stem cells would fix like genetic disease that we had no cure for, or cancers. So that was my early journey, very Western. And then years later, through my actually health journey, I became more interested in functional medicine, because going to the root of the problem, I saw a lot of sick people. And unfortunately, even cancer comes in because so many issues have been going on unaddressed until the cells give up and say, okay, I'm just going to, I'm going to explode. I'm going to just divide and divide until I burst, and take that person with me because they're not listening. So functional medicine was like a journey for me, because I had my journey with cancer, and that's when I decided my whole life is going to change. I'm going to eat clean. I'm going to learn, why did I get this? Of course, it was a lot of it is stress and hormonal imbalances. And I just, learned this for myself. And I said, I'm going to offer this to every patient that I can, help in their life and in their journey, because it is very important. In Western medicine, we just put a bandage or give a pill, try to fix something, and not create a system that would remove the cause or help the people to understand, why did this happen, so it doesn't happen again, or completely cure it. So that is my journey. And going through functional medicine, I think it was an amazing experience, because you go back to your biology, physiology, the very basic things that we took the first year in medicine, and then we forgot about it because then, you don't use it. So going back to the cell and the gene, and then your code and how things are, reacting in your body is very important, because we're a chemical reaction, honestly. And that's where I started like going back to the very essential things that would make the cell heal on its own or function better, right? And one of the biggest things like that I got involved in is hormone therapy. And most of my patients are men. I do see some females, but most of my patients are men. And I think it's by default over the last 15 years, it became men's hormone and men's longevity. And as we evolve, we are trying to now reverse aging. So I think that is important, and we have to evolve, like we have to evolve in life. So that is my reason to get into this. And unfortunately, because a lot of people are just getting things online, or there's a Dr. Google that evolved during COVID, a lot of people are just harming themselves, not knowing exactly what to do with things that are maybe called research molecules, and they're buying it in the gray market. There was a whole story behind that. I don't know if you want to go through this, how they ended up being in the gray market and they could be sold online and anybody can get them without even knowing the dose, without knowing the side effects. And then after a while, they say it didn't work. I'm always on Reddit and chat, rooms. It didn't work. I'm having headaches. I got blind, like crazy stuff like that. Well, guess what? Things can happen if you're using a medicine and not realizing that you're not a doctor or, a trained person.
Now, the thing, I'm just going to make this quick comparison. Maybe it's a little bit exaggeration,
Yes.
but stem cells are brilliant, but they're very nonspecific unless used in a very unique way. And, but peptides are very specific. There are over 7,000 known, but they're very specific and they have to be used in a specific way. There's certain peptides you get one effect if you use it in the correct dose and in a low dose and the correct dosing. And if more is better. And you get the exact opposite effect if you use more, if you're not using it in the correct dosing. And then I'm going to quickly add to your gray zone just a little bit. When we're dealing with injectables, what you're dealing with is it has to be a lab that's certified with hoods, and it's a wet lab. It's very specific. And when you're buying things over the internet, you don't know what you're dealing with. And this could be very detrimental. And more than that, you really don't know or understand your dosing or what you're dealing with. So let's start with now, because in talking about males, you mentioned three things. You mentioned the brain, the pituitary, which release down to the testicles and then down to the Sertoli cells. So you went 1, 2, 3. Can we start from the top, the brain? How does the brain affect male sexuality and male sexual balance?
So first, the stimulus happens in the brain. So men could be stimulated by visual, touch, smell. We know that they are more visual than females. So all these centers in the brain could be triggered. We call this libido or the desire. And there are chemical transmitters, which we know them. They are basically small hormones or peptides, if you want to call them, that are triggered from the hypothalamus is like your master, goes down to your pituitary, and that sends the messages in a very close loop fashion. So it's a positive, negative feedback loop. That's how our hormonal system always operates. So we don't overshoot versus somebody taking a big shot of testosterone. When they do that, their body reacts and shuts down the brain. That's how it happens. And the brain stops making any testosterone. So it's almost like a chemical castration. So the brain sends the signals down to the testicles to tell the testicles through an LH chemical, like a little transmitter or a peptide, LH, and the other one is FSH. LH goes to a cell called Leydig in the testis, and another cell called Sertoli in the testis. Sertoli does testosterone. And the Leydig cells, Sertoli makes your sperm. Your sperms. And Leydig cells make your testosterone. But they both are connected. There's a loop, right? Once these are turned on, then the testosterone goes out in the circulation to react to certain organs. So it would go down to your blood vessels and release nitric oxide through that signal that came from the brain. Nitric oxide is like your natural blue pill, right? Your body has your natural blue pill that opens the blood vessels in the penis and creates an erection. Testosterone also goes back to the centers through estrogen and creates that desire and the interest in having a sexual relationship with somebody. Also, testosterone works with energy and, feeling like you can be more, stamina and energy and all that kind of stuff. But also testosterone goes to the testicles, and it's most of the time it's bound to a protein. It is released freely 10 times as much than whatever we know blood levels in the testicles to make sperm. And that's the journey, because that male has to execute the function and create babies for the next generation. So all these chemicals and loops go back to the brain and say, hang on for a minute, we're going to take a break. We're already done sperm right now. We're just taking the break. We don't need it right now. We don't need more testosterone. Relax, and then go back. So all this happens through a loop, through something called gonadorelin releasing hormone. And I'll tell you, our body releases these like spikes every 60 to 120 minutes. It's interesting. So we're very cyclic. We don't have one big chunk of hormones sitting all day. No, we're very efficient. Little pulses, very important. And that's why when we do peptides, they have pulsating, has to be cycle. So the gonadotropin release hormone goes down to the tissues, release the testosterone. Testosterone goes back and say, we're done. Let's slow down. And that's where the function of those peptides. So I hope I drew a little image of brain sending signals to the testicles. Testicles send testosterone out to do the job. Testosterone actually makes some estrogen that also reverses the loop and goes down to the brain and say, we need some desire. Estrogen is very important for desire. You know that, for libido. So all these work together with the system that we know is a very important vascular system. That's what fails for men. That's why ED happens mostly. The most common type of ED is vascular. So the blood vessels are not making nitric oxide because they're older. Endothelium or lining is older and not functioning, and they're getting stiffer. So they're not as flexible and building up with blood. And the penis is one of the most important organs that gets gush of blood from the arteries. That's the erection happens that way. While, very smart device, the veins, they tighten up. The blood comes through the arteries and the veins tighten up. That keeps the blood in the penis until the whole action happens. That is through nerves and through nitric oxide that pushes the circulation in there. Now, when the act is over, yes.
Go on.
The act is over, the veins are released, and the circulation keeps on moving, and that way the erection ends. So the cycle ends at this point.
Yes. So if someone came into you and you saw that they were low in testosterone, they're complaining psychologically of low desire. They don't have that vim and vigor. They have no, Chinese would call it yang. Go out and grab life by the tail and make it work for you. They don't have that. Where would you begin? You'd begin with a blood test, because when you're dealing with peptides and creating these changes, this has to be followed.
Yes.
You have to understand the baseline and then be able to watch it. Is that so? Can you walk us down that trail you would take?
So you know that as clinicians, we first have to ask some questions. We have to understand that history is very important. It's like being a detective. You can pick up on so many things from the history, and you can understand where the problem is lying a lot of times from getting detailed history that you know what you're asking for. Then after the history, we usually do a simple exam, but also it's very important in that exam is to do blood testing, because it's a very tight system. We were talking about it's a closed loop, positive and negative feedback. So anybody with low testosterone, I think the numbers, like the approved numbers, they say at 300, the libido goes down. 300, like when you draw your blood in the serum. And that's when people want to be, probably treated, because at 300, they lose the libido and the desire and the ability to function properly. So, but again, you have to take that blood early morning, right? You can't take it after an exertion, like they couldn't have been on the gym for the day before, exercising tremendously, as guys do now, or played a football, or, did like a major, or had a cold or a flu. You want to be in your normal, typical time. And most guys get a morning erection because the highest peak of testosterone, remember, the hormones go in and out, like in our body, like are released in a pulsatile manner. So testosterone peaks in the morning, and there's little teeny peaks later. That's why they have the morning erections, or even at night. So basically, you want to check the testosterone early in the morning. You want to do also free, total, bioavailable. And as I mentioned, testosterone is bound to a protein. And that's another smart way of our body. It just binds the protein on a carrier, the testosterone on a protein carrier. That's why proteins are important, right? They carry your hormones. So you have to eat proteins. So your protein carrier is called sex hormone binding globulin that actually carries testosterone and others. So you need to measure that. But also you need to measure other precursors of testosterone. And one of my favorite precursors, and you'll be shocked. Yes, but before that,
progesterone.
Yeah.
Cholesterol.
Yeah.
First,
cholesterol.
Cholesterol.
Cholesterol, you got it. And before cholesterol is vitamin D. So people now are getting all this, like their doctors are putting them 90 million prescription a day of cholesterol lowering drugs. Crazy.
I had someone come in last week. His doctor has him, and he's very happy with his levels. He's 120 cholesterol.
Zero testosterone. So the number is, I think, 125. If you're below 125, you're not, or 125, you're not making any sex hormones or adrenal hormones.
How about immune cells?
Yeah, it's really sad. But you know what? We're backed up with pharmaceutical companies that are just making billions of dollars because this is the top selling medication in the United States. And I think the top selling medication should be vitamin D, right? Cheap vitamin D for $10.
Over the counter.
Over the counter. Yes. That will make all your sex and adrenal hormones, which is your immune system and stress mechanism, right?
Uh-huh. So you start out, you do quick physical, then you do blood tests, you get your baseline levels.
Yes.
And then you find them very low, as well as symptomatically low. Now, would you go to Gonadorelin?
Okay, so a quick thing before that, I sent you a picture of that. There is, we can share it with our viewers. There is SHIM, we call it SHIM, like a sexual assessment questionnaire, because men should be able to figure it out. Like, maybe not everybody has me asking for a history, or you checking their history and how they're doing. But there are questionnaires, and maybe we can share that. Like, that would pick maybe some of the problems. Why are they probably having issues, like, early AD from lower testosterone, or, other parts of their libido is like down. So I think that's an easy questionnaire that people maybe we can add it or put it on YouTube. If we're going to do YouTube later, we can share it on YouTube. I have it on my YouTube as a questionnaire.
I would love that.
Yes. But the symptoms that guys should watch for, it would be like they're fatigued. They're not sleeping too well. They go to the gym and they're tired, like they can't do whatever they did before. Or they go to the gym, but they're not building muscle as they used to. Guess what they're building? Fat around their belly. So I would say, like, usually people
they wake up exhausted,
not focused. It's the leadership, right? Hormone too, less motivated. But people just think of it as a sexual hormone. And once they're just having sexual issues, that's when they say, oh, my testosterone is low. But guess what? That's important to learn, that testosterone is a very important building anabolic hormone. It determines a male from a female. Females have testosterone, but males carry on and do the strong, I mean, I don't want to be a feminist or whatever, but men are designed different and they can do more physical activity and they have that ability to take care of a whole family because they have different hormones. That's the deal. But now we're seeing less and less testosterone, so different roles are changing. I don't know, that could be it. So if we want to
That
go
would be very interesting.
if we want to,
That's a whole other story. That's another show.
that's another.
And boy, will we get calls.
Yes. But I think the difference between a male and a female in structure and functionality is the balance. We all have the same hormones. It's just the levels are different, from one person to the other.
So now the gonadorelin,
Yes.
it's a synthetic.
Yeah.
But it affects both the LH, the luteinizing hormone to stimulate testosterone, and the FSH. So usually if you just give testosterone, very often you suppress the ability to make sperm cells. But with this peptide, you're stimulating testosterone, but you're also stimulating a strong, potentially healthy sperm cell. And, so that's where I'm going to go. I'm not going to, in order to get a strong, healthy sperm cell, you need to work with diet. You need to work with antioxidants. You need the vitamin D and the adequate protein. You need to create and give the substrate so you can make a strong, healthy sperm cell. And so the gonadorelin is the beginning treatment. But then there's a Kisspeptin. What is that? Can you explain that to us? Because they appear to overlap.
Okay, so I have a way of describing them a little bit so that we know which one is where. So Kisspeptin is created, it would work on the gonadorelin releasing hormone, the very top one from the hypothalamus. So in the brain, we have hypothalamus, and below it, like two little balls, is the pituitary. So hypothalamus is the big boss that sends hormones, signal or releasing hormones to your thyroid, to your adrenals, to your sex hormones, and all these, right? So the hypothalamus is the top one, and that is stimulated by Kisspeptin. It's a kiss and a peptin, right? It was created, Hershey, wherever, Pennsylvania.
Yes.
So we remembered it by that because it's the Hershey, the kit. It's in honor of the Kiss chocolate. So gonadorelin releasing hormone, that's the one is released. Remember, we talked about it every 60 to 120 minutes. That is the hormone, gonadorelin releasing hormones, that starts at puberty. Before puberty, the young kids did not have any of that, but during puberty, they start producing it so that their sex characters change, their body change, their sexual interests change. So gonadorelin releasing hormone is the one that is controlled by Kisspeptin, has that function. So this means it will go down to the pituitary, stimulate the pituitary to produce LH and FSH. So the first one in the whole hierarchy is gonadorelin releasing hormone. Okay, that is Kisspeptin. It will work on both FSH and LH. And we talked about FSH and LH. They work on the testicles in different ways. One, it will increase spermogenesis, and the other one increase testosterone. And including, like, cosmetically, the testicles will look good versus pruny when they take testosterone, all that kind of stuff. So the sexual development of the appearance, also phenotype or structure, looks good. So first one is Kisspeptin. The one underneath it that is from the pituitary is gonadorelin. Okay, that is like the gonadorelin is out of the pituitary and is the one that goes down and does FSH and LH. So the FSH and LH also go out pulsatile, still will do the same function without damaging the problem where we're saying, okay, if you're taking exogenous testosterone, you're going to block everything up. You're not, because you're actually giving them pulsatile. We're still, whenever I do that, I don't give the patient, they have a very short half-life, right? Half-life meaning like they are going out of, the system, for example, or given in a shot. If they're coming from the brain, they're released as a pulsatile and immediately go out and broken down by enzymes once they do stimulation of the receptor, right? So that's why peptides, they don't last for a long time. They're very short acting. Once the kisspeptin goes out, it goes down to the pituitary, stimulates the pituitary, it's broken down, it's done, it's digested by enzymes. So it has a very short period. So when I give it, I don't give it all day. I don't give it 3 times a day. I don't give it 4 times a day. I would pulsate it. I would give it every day or every other day to mimic some of the natural responses that your body has. So that's the key of pulsating your peptides.
Now, if you give it every day or twice a day, because we all know more is better.
Yeah.
That was sarcasm. We can really turn off our receptors. We can make our receptors unable to respond. That's why it's very important to understand dosing. But there's another one that I find interesting, and we talk about it as the love peptide, and it's called oxytocin, and we've talked about it. It's released, and it's interesting because all these are male and female.
Yeah.
It's only dosing and how to dose them. And that's the important part. But there's oxytocin. We think of that as a female hormone.
Yes.
But is it important for males?
So oxytocin got discovered in the clinical field because oxytocin was given to any lady that went to labor. They gave her oxytocin to get into contractions and deliver the baby. So it's released in large amounts when the baby is kind of like ready to come out. Females produce it, oxytocin. But or clinically, if they want to induce a female, they give her more oxytocin in an IV drip. But we know oxytocin has amazing functions. So oxytocin is released during orgasm. And that creates the sensation of bonding and the sense of, like kind of being together after a sexual interaction that creates that feeling. So some men are very low on it, in it, and then they feel like just want to run out of the house after that, right? Or some of them would just hang out and cuddle. So that's the difference. And it's funny because I shouldn't say that, but I find a lot of men who do have deficiency in oxytocin, they're kind of like a little bit grumpy, or executives that their staff want them to go on oxytocin. And when we put them on them, they call me if they're out. Now they're more loving. So oxytocin has this like kind of effect of like feeling good, right? And but also oxytocin works on the cavernous receptors in the penis, so it improves the erections as well. And an oxytocin, probably if you've heard about that, has been used in immunity for cancer patients. I think it was breast cancer. There are clinical studies using high doses of oxytocin for cancer because it regulates your immune system. So some of these molecules have different functionalities, but that's one of the reasons also we say having a good sexual relationship and having a partner in your life and having sex on a regular basis creates all these beautiful hormones and endorphins that boost your immune system. You've seen this on TikTok and constantly saying, have more sex and you'll have better immune system, right?
And it affects your brain and your attitude in your life. But I want to get to another one, PT-141.
Yes.
Now,
So that was,
let's
that was
talk
good.
about that. That's a good one.
Yes. So PT-141 is pretty interesting because it was discovered when they were doing, so that actually is was used by pharmaceutical companies, and it's out as a medicine that was FDA approved for females. So it was discovered when they were creating a tanning drug that stimulates the melanocytes. Melanocytes makes your skin tan. So that drug that was created, they find that it stimulates the melanocytes, but as I don't know how many, like 280 male subjects, whatever, they found that they were getting more aroused and frisky and having better sexual encounters. So they figured like, okay, like the Viagra discovered by accident. Okay, from a tanning, medication, let's put it and have it in the, because that will pay better. So then they discovered this like molecule, the PT-141, and it's from the melanocyte stimulating hormone, kind of the hypothalamus again, that stimulates that. And it initiates the desire, the being aroused, but without without stimulating, like it bypasses the other pathways, which is nice. So it works mostly on psychologic issues. So if somebody's having trouble with ED, that psychologic stuff, which is not as common as the vascular, but if somebody had a stressful encounter one time and his erection wasn't good, then now it's in his brain, then next time he feels, oh, it's not going to happen, and that's the psychologic, or a tough relationship that's going on, or somebody having major stress at work. So the psychology plays a big role of having a good erection. So PT-141 bypasses the other pathway that we talked through the brain. It goes directly and increase the desire in the brain. So you don't need stimulation. All the other ones, you needed stimulation. The other ones, you needed to smell something and see something and be aroused by a female or a porn video. But, basically this one, you just take it, you're going to get an erection, whether you're stimulated or not. So it's almost like an instant kind of thing in 30 minutes. Everybody's different. Some people like it in 20 minutes to 1 hour, they will have an erection. But also it increased the strength of that erection, working on the nitric oxide as well. That's another side of it. But that's the beauty of it. It's the psychologic bypass.
And so what happens is that for people who are not Viagra works on the physiology,
Mm-hmm.
but there's many people that it doesn't work for. Whereas this here, PT-141, works on desire in the brain, but it also works on the physiology in that it increases the flexibility of the veins and the arteries, and it allows a firmer erection. I also, again, we're talking about dosing.
Yes.
There are cases where people they got to have an erection. They've got to have a sexual encounter, or they feel almost a compulsion. And whereas, so you want the right dose.
Yeah.
You want it correct, and you want it administered in the right way.
Yeah. That is true. So the dosage of PT-141 is very tricky. We can start at 1 milligram, for example, and monitor when they get an erection. We have to wait for them to respond to us and say, when I took the PT-141, I got an erection in 30 minutes. But someone would take it and it's like 20 minutes or 1 hour. It might last for 3 hours, and some people last for 12 hours. They still can get the arousal easily.
Interesting.
But we want to make sure they don't get priapism, which is like a prolonged erection that doesn't go down, because that can harm the circulation and cause destruction of your, I want to call it destruction to warn people, because honestly, people will have damage to their penis. If they are having an erection, it's not fun to have it for 2 hours, because then too much of the blood pressure, the blood pressure in there, it will just damage the tissue, right? So whenever we call it priapism. So when this happens, they go to the emergency room, or I have a trick. I usually tell them just use pure Sudafed. So when somebody's trying PT-141, I want to make sure they have this in the background. And if they're young and they have good circulation, right, they could feel so hard and not release, because it's it's the feel and a release.
Too strong.
And that would create a strong erection that lasts for hours, which is dangerous. So I just want to warn about that. So we start at low dose at 1, and then if they don't get a response, maybe we can go to 1.5, and then the next dose would be 2. So that's how we have to manage patients. It's not like people getting it online and like, hey, bro, how much should I use? It's
This
like,
this is the amount that's done and it's given and all of this, but everybody's so unique. You also don't want to have hypertension when you're taking this.
that's one of
That
the
can be a problem.
yes.
And so there are
You have to
some
examine, right? You have to be under doctor's supervision. If somebody has blood pressure, they just, that's high and they don't know and get it online. You're very right. They can hurt themselves. Yes.
now there's another one, and
But it doesn't go out of this one because females can
Okay.
get BPC-141. So that's a vial or a treatment that couples can take home, which is nice. So I tell the guys, like, if you take it, your wife can use it as well because
wasn't it first
I know.
developed for women?
So it's FDA approved for female for those who have hyposexual desire, which happens most of the time after having babies and the hormones are messed up. So most females end up like having a problem. So it's very
And
common.
they don't sleep for a year.
Progesterone is low and they don't know. Nobody's telling them anything about it. Yes, except you, Corey. Yeah.
But then there's tesamorelin. Tesamorelin, very important.
Yes. So tesamorelin is another one that is cool because it is another hormone. Sorry, like it works on the growth hormone. So tesamorelin, even though the name sounds like testosterone, it works on the growth hormone. Okay. So, and the reason I like to give it for males, first of all, you have to measure. Most people, and I'm going to surprise people right now, I find people with low growth hormone at 25 and 30 years old. And that's the first hormone people lose. And that's the hormone, that's the building hormone, meaning it's important for our muscles, for our bone, for our brain, for our
bones.
Yeah, for everything.
Brain.
So we are not made to live forever, unfortunately, surprise. And we're supposed to decline around 30. So physiologically. So basically, growth hormone is an important hormone to test for. And I find in men with lower numbers of growth hormone, they also have lower sensitivity to the testosterone receptor. And once we do tesamorelin, it will increase their growth hormone, meaning like they will feel more energized, they will sleep better, their muscles will build again, their bones will be strong. It's another leadership and a feeling good hormone. But so the energy is amazing, but also the ones that were low because of the growth hormone, their testosterone is going to work better on the receptor level, because testosterone has to go on a receptor to work on the cell level. And also there is increase in erection. So reportedly increase in erection strength, which is good.
And they find that working this tesamorelin with GLPs is very, very effective because the blood sugar is balanced while you're building the growth hormone. And the growth hormone is essential. You don't want growth hormone to go too high. Tesamorelin is special in that it doesn't over push. It stimulates your body to make what your body wants.
Yes.
Optimal for your body. It's not like giving growth hormone that you could double or triple the amount and become a great problem.
Yeah.
But when you put it with the semaglutide, the two together, you have a blood sugar balance, which helps the tesamorelin balance. And this is, what we've come back to? We've come back to an art.
Yeah.
Before, we've come back to the art of balance.
Yeah.
This is not, you look at a book, it's all individual in how it works for you. And I really believe that this is and can be potentially the new face of medicine. Dr. Bar, it's really a pleasure. It's a pleasure picking your brain. And it's kind of fun because this is a subject that we don't cover a lot. But now what we're going to do, we didn't go to the audience today on purpose because there was so much to say. There is so much. We had to set the background. So could you give your website and contact information? And then we're going to go to the YouTube page, Take Charge of Your Health Radio. And if you have questions, which I know you do, I do, we all do, just type them to us and we'll be there for a few minutes answering any questions you might have. So it's Take Charge of Your Health Radio, and we'll be there answering questions. Now, could you give your contact number to
Okay.
us?
So our office number is 949-706-1212, 949-706-1212. And then my website, it's my name. So it's drbarmd.com. So drbarmd.com.
Very good information there. My website is Corrine Health, CORINNE Health, and we have Facebook, Take Charge of Your Health with Corrine and Carol, and I have a personal Facebook, Corrine Fernari, PACCN, and we'll be back next week. Reggie, thank you so much. Yes. I just please do.
No, real quick. This is my book that every guy should get. It can be hard. On Amazon.
That sounds like a good one. I think we all have to explore that one. Men and women.
And yeah.
Okay, so
fun book.
Okay, so it's just ending, and we're going to go over to Take Charge of Your Health Radio. We hope you join us and type us some questions. You must have them. I know you do. I do.
Thank you.
That's all for this episode of Take Charge of Your Health. This program shares information to help you become an active participant with your healthcare provider. It's not intended to treat or diagnose. Visit CorrineHealth.com and Carol Peterson's The Wellness by Design Project.com. Join our Facebook page, Take Charge of Your Health with Corrine and Carol. Subscribe on YouTube at Take Charge of Your Health Radio to submit live questions. We'll respond. See you next week. Bye-bye. This is Jeremy Murphy signing off.
To follow very, very important things. Number one, they have to use it as a period where they're going to change their lifestyle, because that is key. I find people are on it and they're off it and they're back to square one. So they have to change the lifestyle, meaning if something's going to help you not eat the junk food and the quantities, that's where you set in 21 days, you create a new kind of habit, right? You agree? So that should be number one. Change your lifestyle, because you can now. You have an amazing supporter for you. Number two, make sure of what you're eating is not something that is low in protein. It has to be very high in protein, and it should be low in carbs and low in fat. So balance. Maybe I like people to make sure if they're on the semaglutide diet, eat more vegetables. You're never going to hurt yourself with the protein. That is the simple advice. I'm not going to tell them do this or that. I've done a video for what to eat with semaglutide, but honestly, very small amounts. And if you get used to this, that will be what you eat for life. Then that's great. Protein with a little bit of vegetables. There you go. Now, yes, go ahead.
So often, and what has happened is you go into a doctor, they give you a semaglutide, a GLP-1, GLP-3.
Yeah.
And what happens is people start losing weight. And then it's really not discussed. It's not explained that this is not a monotherapy.
Mm-hmm.
This therapy goes with diet. This therapy goes with protein. This therapy goes with exercise and how important it is. So so what's happening, and people are talking about this, there's two things that are happening. One is that they stop taking it and boom, up comes their weight again.
Yeah.
And even faster than it went down. But the other is stomach upset, constipation or diarrhea with these. I think that they're fabulous when they work.
Yes.
And how do you get through that constipation or diarrhea phase to get them to work for you?
So the side effects are common. I think they have to be managed by a physician or somebody who understands these or dedicates some time in their clinical use for them. So basically, it slows your transient time, meaning like it will slow your gut. That's why you feel full. So very important. Again, if people are taking vegetables, if they're on something to make sure that they're going their motility, at least they're going and, making sure they're getting rid of the toxin on regular basis, like using something like a laxative or something to stimulate their gut to go on a daily basis, then they're not accumulating these toxins in their body. Because once you remove fat cells or shrink fat cells, you're releasing toxin. It is the best store for toxins, the fat-soluble toxins. Where do they go? We cannot poop them. They go into the fat cell. You start shrinking that fat cell, it will release more toxins in your body. That's why people get sick when they detox and start losing a big amount of fat or weight. So putting them on a proper laxative, making sure that they're going every day to the bathroom, making sure they're hydrating, because that's another reason they're not even drinking or eating. They're nauseous. They don't feel like it. So it's very important to kind of make sure these are managed in a proper way, because it is a side effect of the medicine that makes it successful. Slow transient time. Did that answer the question? Did that help?
Yes, very much so. Because I think many of us want to, or many of the patients want to try these, but have been turned off by the talk about side effects.
Yes.
And so, just like with what we were discussing before, the side effects can be mediated to a large degree when you're working with someone that understands what they're dealing with.
And measuring maybe what's your fat content, what's your lean body mass, because we want the lean body mass to go up and the fat mass to go down. And it's not by looking at the scale. So a lot of the people that are used to weight loss are just focused and centered on, like, my weight didn't drop this week. Guess what? Are you fitting in your skinny jeans? Yes.
Exactly.
Fitting into a dress you've never wore for 20 years? Like, yes. It's like, okay, so your body's changing. And now you have a waist, and before it wasn't because of the fat around the belly. So basically, they cannot just focus on a number on the scale. It has to be measured also and visual, because people are very visual, and they're so used to, like, oh, my weight is still up, it's not working. No, you need to measure, like a test. What is your lean body mass? What's your fat percentage? And I actually do a blood test as well to measure fat, albumin, globulin, to make sure that they are actually also going up, not down.
Okay.
Yeah.
So that's important.
Yeah.
The guidance is important, essential
Yeah.
for the ability to have it work. But
I'm
there's
gonna
two others.
I'm going to share with you.
Oh, you do? Now, is that the Desbio?
I buy Lingo. Lingo, you don't have to get a prescription. The other one, I had to get a prescription for it. This one, you don't. You buy it from Amazon. It's called Lingo, and it doesn't alert like
Lingo.
Lingo. I'm not promoting them.
Lingo.
Yeah,
Okay.
they're $40 each. I think you get 2 together. They ship them, and I think it's worth monitoring, especially if you're adjusting dosage or knowing want to go up or down or something, so you want to know where you are. So it's a great way. And now it's one of the things that a lot of biohackers and people in functional medicine saying regular glucose monitoring or, ongoing glucose monitoring is a way of measuring how your health is. It's one of the things, because sugar is your worst inflammatory molecule. It's worse than alcohol. Yeah.
I think that's a great idea.
Yeah.
And I wanted to talk about two other peptides. I knew we weren't going to have time on the show, so I saved them for later because they're really, and they're very common. People talk about it constantly. It's the BPC-157. And yet there are some caveats. People have to understand how to use this. Please, can you explain that a little bit to us?
So I have to tell people, please, because I think that's the most kind of purchased peptide on the market. People are just buying it right and left. And the problem is with the BPC-157, it's a very safe peptide. I've never yet seen a single side effect from it. However, when I check the Reddit and these chat rooms, a lot of them are having problems. And unfortunately, it can be two things. One, because they bought it online from a company that claims they have a certificate of analysis. So I made a video, it's on YouTube, how to look for and what to look in your certificate of analysis. Still, those guys would put certificate of analysis. Guess what? It's not made for that batch. You need to look at the curve and see and know how to read it, because they can just say certificate of analysis on the website and certified how, So if you don't know how to read that certificate and assume that you're buying something that, some shady person online did it in their garage, got some powder from China and capped a little bottle and put a sticker on it, because anybody can do that now and make $50. No, it's not good, because these are powders. Most of the ones from China has been tested for so many heavy metals. It's crazy. Or mannitol, or not even having any proper dosage. So fillers, or not a proper dose of whatever the peptide is, or heavy metals or toxins, right? So that is a big problem. So those guys get the BPC, and it's cheap on gray, whatever, gray market, they call it, or the black market. And then now they're taking high doses because nobody guide them. And they're using it every day and using it for 3-4 months, right? I like the cycle. And then all of a sudden, they're having weird symptoms. Tingling, numbness, all kinds of crazy stuff, which could be heavy metals toxicity. But they're not even testing for it because they're not followed by anybody, right? The other thing, when I do peptides, I like to do a comprehensive metabolic panel. I want to do their, cell count to make sure their immune system is fine and all that. It's very important. Why? Because I wouldn't do any of this stuff if their liver functions and kidney functions are not correct. I want to do my due diligence and make sure, okay, I'm not giving it to somebody who's diseased. Not that people can look good, but they have issues and they don't know about it, because nobody sees the doctor anymore, maybe once a year, and they don't even get a full panel. And then the third thing that is very concerning with these is that, unfortunately, and people don't talk about that. So BPC-157, very few people will react to it in a certain way. And it's almost in idiosyncrasy, but they would be either on antidepressants or taking too much coffee, and they react in a negative way, and they get psychologic, and they get depression, they get agitated. So a lot of neurologic symptoms can happen. But however, nobody's telling them that. And then they go and say, I want it to be suicidal.
And it doesn't work.
And it doesn't work. Which is one peptide that's so benign and so easy to use if properly prescribed.
I had a patient who broke her leg.
Yeah.
And I used it for her. And she had very fast healing. Within 2 days, 2 days, she was complaining of lots of pain. Within 2 days, the pain was gone.
Yes.
That aching, throbbing pain. And she healed very rapidly. So it was really quite exciting.
Amazing.
To use that with her. But just like we said, you got to use it correctly.
Yes.
And dose it correctly. She wasn't on it for months. She was on it for 4 weeks. And then we stopped. And she healed magically. And she is in her mid to late 60s.
Nice. Yes.
So it was very impressive.
Yeah.
Now,
sorry, but on your patient, I would use with her, like if you're doing BPC, especially for injuries and broken bones, I like to use it with red light because it's cheap and it's easy. And I put all my patients on red light. So if you have a patient like that in the future, I would use some other modalities that actually enhances that absorption.
Enhance
Using
the
it at
action.
home. Yes. I'm sorry. Go ahead.
No, enhance the reaction.
Yeah, because like if they're injecting it subcutaneously in their abdomen, right? And then they have the knee or the ankle. So they will put the red light on the knee or the ankle because that opens the circulation. The same trick that we did on antibiotics or stuff like that, right? So increases the circulation and whatever's in your system will be targeted more to that spot.
Great.
Just a trick.
Great.
A little trick.
Yeah, I've got the red lights.
Yeah.
I use them more for sores and for soft tissue, but that's a very good idea. But then I want to talk very quickly because we could talk all day.
I know. We love to other. I enjoy being with you. Thank you.
Me too. GHK-Cu. Now that one is getting a lot of attention. Now I used, and I had some amazing results with PRP
Yes.
and hair growth.
Uh-huh.
Just amazing.
Yeah.
But what they're saying with GHK-Cu or GHK copper, they're getting amazing results with hair growth, hair regrowth, and hair, which this did not happen with PRP. Hair is supposedly coming back in even without gray, which is surprising, hard to imagine. And but then they're using it as an anti-inflammatory and for skin and for collagen and for elastin. We know that it's an anti-inflammatory. When pigs used to get stomach problems, they used to put copper in their food and they would eat the copper and it would push out the parasites and reduce the inflammation. When they used to, it was called copper asprinate. Copper and aspirin were a single pill to bring down the inflammation and reduce the pain. And that was for years. That's the way you could get aspirin. But now they're using it as a peptide. I'll pass it to you.
Thank you. Yeah, it's an amazing peptide. And the copper is the one that causes the burning. So some patients don't like it, so you can make it with or without the copper. But when you inject it, I'm just letting people, like, the copper is what makes it burn a little bit. And it also depends on the concentration. So I've seen a lot of the things out there with very high concentration, and the higher the concentration, it's more painful. So people should be careful with that. And it's not because they're having a reaction, but it's because the concentration is high. So people should be careful. GHK also, so all the things that you mentioned are amazing. Yes, because it increases circulation, which is a big thing. Angiogenesis brings back the blood vessels. So that's one of the kind of the magical things. That's why it just improves the hair follicle. With age, we lose the blood supply of anything. So that's one of the reasons. But also it's great for wounds, for wound healing. So I mix that with BPC-157. But my favorite, GHK, is one of the anti-aging peptides. Did you know that? Guess where it works?
Because it's so anti-inflammatory.
Yes, but it works on the telomeres. So it's one of the things we
the
program.
was not aware of to that degree.
So it works on the telomeres. So I use it in the longevity program that I have, and I wrote about it in my Biohacking Your Stem Cells, in that book where I wrote about some of the things that you can work on your telomere length. And telomeres are the very teeny ends of the DNA. When the DNA, which is your genetic code, is trying to divide and creates a new cell because your old cell is dying, we regenerate constantly. That little teeny end, like my nail here, like the tip of the DNA, would get shorter and shorter and shorter until we don't have any more, and then we die because the DNA cannot divide. So telomere is very important. Telomerase is the enzyme that works on that. And actually, GHK works on that. So it's super cool because it preserves the telomeres and helps them not decay or disintegrate, and helps the telomere lengthening it. So that is one of the things that we actually measured for telomere length. We measure it when we're trying to see the biologic age remember we have like a chronologic age on the driver's license, but we have a biologic age, which is very important. So that is one thing that we watch for, telomere length. GHK, there's one other thing that I was thinking about GHK. So the gray hair, which is so cool, which is a really nice thing, a little extra thing to have. I wanted to say something about it, but I forgot now. Oh, no, I do remember. So I think the problem with these peptides, I wanted to say this because that's an opportunity to read online today and people are listening. GHK, they compound, so all these like gray people, whatever it is, as people that worked in the peptide industry, we know the peptides are amino acids, and we know amino acids are negatively and positively charged, and they have to maintain a 3D structure because that's how the receptor works. So amino acid works on a receptor in a cell through charges. We are biochemical beings. We are positively and negatively charged. Hopefully everybody knows that. So these charges are very important. So these amino acids are very delicate. That's why you cannot eat most of them. You break them down with the acid. It's HCl, you know. So basically you have to inject them. And you have to inject them, and they can only survive in a certain amount of days in the fridge once you suspend them. And they have to be suspended in a certain way so that they don't lose their structure. Now, a lot of these companies are mixing all these peptides together and calling glow and clo and whatever, just to, sorry, I'm going to say, you can bleep it, bullshit. Bullshit. Because you know what? They're going to bind. It's all about I have a video on that. I put it out on YouTube. They're going to bind the positive and the negative. So BPC and TB4 or BPC, TB4 and GHK. These are peptides that all have different -2, +2 charges. They will just bind. When they bind, they lose their structure. When they lose their structure, what they do? They go to the receptor and they don't look like this anymore. They look like this. So they go try to hit the receptor. They can't attach to it, which is their only job. They are signaling proteins. So I'm just warning people, do not buy all this like combined. If somebody wants to use them together in the same setup, because I usually recommend when somebody's injured, for example, I use BPC and TB4. If somebody is doing the hair treatment, I use BPC, TB4, and GHK, and I inject it in the scalp. The 3 of them, but not together.
Oh, not together.
No, because they're going to combine.
Mm-hmm. Interesting.
Or microneedling them.
Now, this is totally off subject. Copper, when it's oxidized, it's blue.
Cupric and yeah, and then it's cupric is green. Blue and green,
when it's oxidized.
Is it green and then red?
Not that I know of. So they're saying on the internet, if it's not blue, it's not copper. Well, I think if it's not blue, it's not oxidized.
Yeah, the copper is green, I think. I don't know.
Bluish green.
We need to find out. I can't remember.
Yeah.
So I think
not going to fight with you about that.
Cuprous and cupric oxide. Like, you know how they cupric. I'm going to cupric.
Guess what? We've really
exceeded.
Really exceeded our time.
But it's green. It's so much green. Fun. Yes, it's
naturally.
Copper oxide depends on oxidative state. Copper oxide is black, while copper is red. See, I remember that. And then when it stays in the air, red, reddish, brown, and sometimes. But then they have all these colors here.
Oh, okay.
Yeah. Okay.
Okay. So I was just wondering. Okay, so it's really been a pleasure speaking with you.
We're going to do this.
I learned a lot. And I know our audience did. And our audience is just getting used to being on YouTube. So we have evidence that people are watching, but we didn't get many questions. I thought we were going to be flooded. So, okay. So we'll have to do it another time. We'll choose another subject and we'll dive deep into it.
Yes. Thank you.
Thank you so much for
Thank you so
sharing this time with
Nice
us.
to see you. Thank you.
And this is Dr. Bar. You want to give your website again?
Yes, it's DRBARMD. So it's drbarmd.com. And I'm on YouTube. I think it's OC Stem Cell or Stem Cell OC. I don't remember. But I think with my name on YouTube, I'm also on YouTube. But thank you so much for the invitation. I enjoy talking to you always.
And could you tell us about, you've got 2 books out right now. Could you give us their titles?
I have It Can Be Hard, which is my favorite topic. It's about non-sexual health, which is super simple. It's hilarious. It's funny. So you're not bored. It's not like, kind of light reading. It will give you a lot of also insights on the new things in sexual health. And my other one is Biohack Your Stem Cells, which I have it there on the other side. Biohack Your Stem Cells is about stem cells and how to biohack your own stem cells to keep them healthy, living longer. And it's less expensive than getting an IV or some stem cell injected somewhere.
Definitely.
So you have your own pharmacy in you, and getting that book will teach you how to keep it safe and replicate them and make them stronger.
Thank you very much.
Thank you.
And we'll be back next week. And thank you.
Thank you, love.